You can just call me the modern day woman with the issue of blood. If you see the kind of clots, some are like the size of moi moi. That is the way I explain it to people.
Wow,
It
wow.
will come out of me, doctor. I went through hell.
It was excruciating.
I was just growing bigger and bigger and bigger, and the pain was getting more. I would bleed so much that my period would now start looking like Ribena, like diluted Ribena.
What year was the first time you noticed that your period changed from being regular to being heavier?
2011.
You had the fibroid for 12 good years.
Yes, for 12 years exactly.
12 years. 12 years of pain.
Speaking of herbal concoctions and all these things, all these powders, all these teas, I can tell you for free that none of them can shrink your fibroids.
Good evening to you, ladies and gentlemen, our followers on the BUF Foundation. Thank you for your love for us. And one of the things we wanted to do this year was to bring inspiring stories from few of our patients, our sisters, our amazing friend that have gone through this journey of fibroid to encourage women, because one of the things we have done is to tell you that it is faith over fear. Today, joining Dr. Benjamin's diary session, we have a very powerful, productive, and beautiful barrister. Her name is Olowojebutu King. She was one of our patients and now our ambassador. She is here today to talk to us clearly from her heart about her fibroid journey. What changed for her? What made it easy for her? Why is she looking a lot better now after so many years of pain? Welcome with me to this very, very important meeting and very good interview, Olowojebutu King. Wande, how are you this evening?
I'm very well, doctor. How are you?
Thank you very much for coming. We appreciate your energy to come and share your story to the people and to a lot of people that follow us on Instagram. So tell us about yourself first. So let's know how this journey started. Tell us when you noticed you have fibroid, and tell us how you were able to overcome your fear in this period of years of pain.
Thank you very much, doctor. And once again, I'm very happy to be here. Talking about myself, well, my name is Olowojebutu King. I'm a lawyer, and obviously I'm a serial entrepreneur. I'm into so many businesses. I'm a very vibrant person, and I'm a very, very energetic person.
Yes, we know that.
Pre-fibroid
Yes.
and post-fibroid. You understand me? So before fibroid, I was very energetic. I was working in an investment company. And then all of a sudden, I realized that there were certain things I couldn't do properly anymore, like meeting my deadlines, meeting my targets, being productive at my work. And all this was attributed to the pain and the changes in my body, which I didn't know on time was fibroid. I just knew that I was having very painful periods, but I thought that was hereditary because my mom also had painful periods.
Okay.
And then at some point around 2011, 2012, I started noticing like thick blood clots in my period. And then even at that time, I hadn't heard about fibroids like that. So, and I didn't even think I could have fibroids. I was just thinking, oh, what is this? And then one of my friends, my very close friends, also had it. So I in my head, I can say that's the illiterate part of me. I was thinking, oh, because my very close friend, so to say, my best friend had it, and then it was telepathic, and then, probably that was why I was having something like that. All I could remember was, oh, so person also talks about this thing.
So what year was the first time you noticed that your period changed from being regular to being heavier?
2011.
So 2011 was when
Yes.
you noticed it.
Yes.
That is 2011. You had your surgery 2024.
2023. December 19.
That means you had the fibroid for 12 good years.
Yes, for 12 years exactly.
12 years. 12 years of pain. 12 years
struggle.
of heavy periods.
Yes, doctor.
12 years of using more pads than regular.
In fact,
So
I graduated from pads to diapers. Yes.
So go ahead with your story. So you thought it was telepathic from your best friend.
Yes.
So how did you now go about that? Go ahead, please.
Thank you, doctor. So there was I was supposed to go on vacation in 2013. And then, I was having these cramps and all of that. I almost missed my flight. And then when I got abroad, my close friend over there came in. She said, when you get back to Nigeria, make sure you check this, This thing could be fibroid. I was like, fibroids, right from the plane. I was staining the seats on the plane.
Wow.
These periods were so heavy that I had to use, then there's this toilet paper called rose color. Always couldn't do it for me
Wow.
then. Right? There's this tissue called rose color. My best friend then, she used to roll it in a very long, in a way that it will cover the front to the back.
Wow.
I will now use many underwear. It was really bad. So when I got back to Nigeria in 2013, before I resumed work, I went straight to the lab because I really didn't enjoy my holiday. And then that was when I found out it was fibroids.
So 2013, you found out you had fibroids.
Yes.
And what were the first steps you took in treating the fibroids? What did you want to do? Let us know how you went about your treatment since 2013. Because you had fibroid in 2013 and you didn't do your surgery up until 2023. How did you cope? Because I can imagine the growth of the fibroids sporadically since 2013 to 2023. That's 10 great years.
Yes.
What were your steps in your treatment journey before you met Dr. Benjamin? Just go ahead.
Thank you, doctor. From 2013, right from the lab, what do you call those guys? Is it sonographer now?
Sonographers, yes.
Okay, he told me, oh, this is fibroid. I was like, what? Fibroids? And the little I had heard about it then was, oh, you had to go for a surgery and all of that. Doctor, you know me, even to get an injection is a problem.
Yes, it is.
Even to take an injection.
Yes.
I can scream the building down.
I know.
Let alone to go
Under the knife.
for under the knife. I was like, what? Immediately I asked the sonographer. He said, oh, there's a lady that came there. She went to one place. She paid then, maybe about 56,000. She got some supplements, some tablets, that could treat the fibroid. That was when my journey began. You can just call me the modern day woman with the issue of blood. Yes, because I spent millions. Speaking of millions, that's how much I spent.
On what?
On alternative medicine.
On
so
herbal
to say.
medicine. Herbal
Not
medicine.
yes, herbal medicine.
Yes.
And also alternative.
So what did they tell you those medicines will do for you for the fibroids? What did they tell you exactly? What encouraged you to be paying the money you were paying, the heavy millions you spent on no solutions? What was the encouragement? Let's know.
Okay, number one, the first thing I took was the, so to say, kind of supplements, like tablets, that they were meant to dissolve whatever it was. And that time, what I was told was it was like the size of an orange.
Okay.
I still had my flat tummy and all of that, but I just had like a little bulge. But you couldn't compare all of that to the pain I was going through. I was ready to pay anything to get a solution, any solution other than going to the hospital to go under the knife. So I paid for these supplements. It went like that. And then there was no solution. Of course, they will tell you, you have to take it for you have to take 4 bottles, you have to take 5 bottles. And then it was running to hundreds of thousands and all of that. There was no solution. I was, my periods were bleeding heavier. And then they were happening more frequently. Yeah, so I also went, I got people to introduce me to herbal medicine. I would drive myself all the way to places like Ijebu, Delta State, looking for a solution. Doctor, there was even one day I got that medicine. The woman told me, it was the woman and her husband, old people, like Ijaw people, yeah. So I took the medicine. So when I get home, one was not touch the ground, one was anything just to take the pain away.
So you had fear underneath you, fear of looking for the right solution because you are afraid of going under the knife.
Doctor, I had fear of, I wouldn't say that was the right solution then.
Okay.
The awareness for me wasn't so much.
Okay.
You get me?
Yes.
It wasn't, even as learned as I was, when it comes to things like this, nobody really wants to just submit themselves to a surgeon to open you up and all of that. You understand me?
Yes.
Let alone someone like me that hardly goes to the hospital, I hardly fall sick.
Yes, you don't fall sick.
So I didn't know that coming to the hospital then, I mean, going on that knife could have been my best solution then, So I was looking for alternative solutions, this herbal stuff.
Like quick wins, yeah.
Yes. And none of it worked. I was just growing bigger and bigger and bigger, and the pain was getting more. I would bleed so much that my period would now start looking like Ribena, like diluted Ribena.
Wow.
Another time I traveled on holiday, I mean, it was so bad. And Igbo people, whether you want to die, they will not even look at you. On the bus, I was clinging onto the rail. I mean,
The pole,
that
yeah.
rod, the pole, yeah. And by the time I got home, it was so bad. I started going to African store to buy ugu. I'll blend ugu. I'll put a little yogurt,
Wow.
just to give me blood.
You
I
went
went
you
through
went through a lot, so
I went
much.
through so
I'm
much.
so sorry. I'm so sorry.
It's all right,
So
doctor.
you spent money that should give you results, but was giving you more pain. And the
It was
fibroid was growing bigger every day.
it was growing bigger.
Like I always tell people every time I tell you that fibroids are like having a baby in the tummy. Whatever you eat, you feed the fibroid, so it grows bigger. Nothing grows down or grows smaller in the womb, because a baby that is in the womb will go from 2 weeks to 3 weeks to 4 weeks to 36 weeks. So that's how the fibroid will be. Everything you feed on, you feed the fibroid. So instead of your fibroid being reducing,
Shrinking, yeah.
shrinking from the money you paid to the people you paid money to, it kept getting bigger and your symptoms were worsening. So what happened again?
After using the herbal medicines, the traditional medicines, let me say it at this point that wasn't those were not the only places I went to.
Wow.
I went to about five, places outside Lagos, even in Lagos. There was a place I went to, if you can permit me to just, explain a bit
Go ahead.
for the sake of our viewers.
Yes, please.
There was a place I went to. One of my aunties took me there. She said one of her friends. I mean, that's how she did hers. It's gonna be like you're gonna deliver a baby. And I was like, really? But you're supposed to say waku ala and wan koto. I mean, desperate
Yeah.
measures for desperate issues.
Yes, correct.
Kind
Yes.
of. Yeah. So I got there, and then I paid. They'll tell you pay 80,000 first, and all. I was just paying. Doctor, I was just paying. Just anything to give me. So there I saw some women, I even thought they were pregnant. So there was one holding her body, holding very, very, very
Frail.
tattered place.
And
A place you would normally not find someone like me. Like,
Like
I'm
a
always
lawyer.
like, this place.
Like find a lawyer.
I just sat down. I was looking. So the man, I thought the woman was in labor. Yeah.
Wow.
So the man was going up and down. He was not a doctor. He even had all those partitioning. The woman was going. All of a sudden, I just, she was just. They took her in. I thought she was delivering a child, only for them to tell me it was a fibroid that was trying to come out. So the man was passing with blood on his hands, the gloves and everything. I left my auntie there. I just told her I'm coming. By the time I got to the car, I told her, are you interested in going home or not? She was, you've left. What of the money you paid? I said, are you interested? She met me in the car.
Wow.
That is another example of the situations I went through. And I'm trying not to get as emotional as possible because it's even happened to me such that I was staying with a close relative at some point, and because I had this fibroid, you know how fibroid presses down on your bladder, on the bladder, right? There's sometimes before I get to the bathroom, of course, I was given a room en suite in that relative's house, and then sometimes before I even get to the bathroom, I'll pee on myself, and then again, you just finished peeing. I can assure you, I can write a book on this thing. Oh.
Yes, you can. I know.
Before 5-10 minutes,
You're back again.
You're back again. So I had to get a red red plastic container. Because I couldn't just be going to ease myself like 11, 12 times before you wake up. It was growing. But I was using tranexamic acid. I was using so many things. There was even this hospital I went to on Adeni Jones. I'm coming back to that issue of my relative. There was a hospital I went to on Adeni Jones. Yeah. They were giving me this this injection around my belly.
Yes.
Every 15, 20 days. Then that was like 2014. Then it was like 25,000.
Wow.
Sometimes you buy it from a pharmacy off Towing Street. The injection is like a screwdriver, very fat. You know it now,
Yes,
don't
yes,
you know it? I've forgotten the name. They put it under my
yes.
belly, and I mean, in the next 15 days, I'm back. Before the 15 days, I'm bleeding again.
Wow.
In my house, in my parlor, I will put, what do you call it? Ike or that, this paint
Yeah,
bucket.
yes.
Because I have to, if you see the kind of cloths,
Wow.
some are like the size of moi moi. That is the way I explain it to people.
Wow.
It will
Wow.
come out of me, doctor. I went through hell.
It was excruciating. I'm so
You know, I
sorry,
had to
Yande.
thank you, doctor. I had to put this red coffee, or it was a creamer container, a red plastic, by my side in my relative's house, because sometimes I have to pee like 5, 6 times, up to 10 times sometimes before daybreak. So, I had to be sent away when they discovered that I was using that. Even long after I had stopped using it, the symptoms come and go sometimes. Sometimes the symptoms are really, really, really bad.
Yes.
That you feel very bloated. People think you're pregnant
Yes.
and all of that. So
So,
after I had
they were
started
calling
using it,
Yabeji.
people were calling me Yabeji very well. My colleagues, people that don't know, even my church members,
Wow.
yes, were calling me Yabeji.
So when they call you
Yabeta.
Yabeji, how do you feel?
Yes, I feel embarrassed because I wasn't pregnant. Yeah. And it's not everyone you can tell that, oh, I'm not pregnant. And again, today I'm wearing this baggy, oversized shirt out of comfort.
Yes.
Just to feel good, not because I'm trying to use it to cover my tummy. Those days I never wore bodycon dresses. I could never tuck in.
Wow.
I could never tuck in. The bulge in my belly was terrible.
Yes, it was.
It was embarrassing. It chooses your clothes for you. It chooses your schedules for you.
Wow.
It chooses your time for you. I couldn't be productive as a lawyer anymore. I couldn't be getting briefs from clients because there are sometimes I have to appear in court, or sometimes I have to represent someone in a legal matter, and I'm at home bleeding.
Heavily.
Yes, heavily. Heavily is the word. Even when I'm not on my period.
Wow.
It was that bad. Before I came to you, doctor, in 22, before I got to know you in 2023, for like 2 years, I was padding up nonstop. Yes, specifically 2021 and 2022. I was padding up nonstop.
Because
I couldn't even have relationships.
Wow.
There was a time I was bleeding. I don't know, it wasn't even blood. It was like, like diluted blood, very, very diluted.
Yes.
Every day. I'm sure you understand what
so
I'm
you're
talking
very
about.
anemic.
Every day. Yes, and I was anemic. Good.
Yes.
I was
Because you're
anemic.
bleeding every day.
I
you're
was
anemic.
short of blood.
Yes.
Doctor, I had it up to here with fibroid. I can write a book on. I can tell people the symptoms.
Excellent. So
right now.
so you've spoken from your heart, and I'm enjoying your conversation because people can relate to what you went through. People can understand that even in buying those herbal medicines that they use to psychologically give you more fear, there's no solution there. Can you tell our viewers that there's no solution in those herbal medicine, that you wasted a lot of millions on? Let them understand it from your perspective. Go ahead.
Hello guys, hello ladies. Speaking of herbal concoctions and all these things, all these powders, all these teas, I can tell you for free that none of them can shrink your fibroids. I don't know what size it is. I'm not sure if it is the size of maybe like a agbalumo or something. Probably it can be melted, and then with technology now and all of that. But one thing I can assure you that you can take to the bank today is that nothing, absolutely nothing shrinks fibroids. Nothing. If we want to be honest with ourselves, that's why I said it depends on the size. You just have to take it out. You just have to take it out. It got to a point I was sitting like this. There's a picture I sent to you. That I was sitting. My cousin sent it to me recently. You know how you also did her surgery after mine. She sent it to me, and I was like, "Is this how I really was?"
Yes, you're very big.
I sent it to my mom, and she burst into tears all over again. Is this how I really was? That was like a 6-7 month pregnancy.
About 7, yes. 7, actually. 7 months size pregnancy.
Nothing. It got to a point. And why I came to you said I should talk about how I got to know you and how we ended up doing the surgery.
What convinced you now to leave the herbal medicines route and you sought for help surgically and you found Dr. Benjamin? what was the procedure? What was the process for you like?
Okay, thank you. That's a nice one. Like I just mentioned now that my tummy had grown so big that it was like a 6-7 month pregnancy when you
Yes.
when I met you. It got to a point when I eat, you can't even digest everything properly.
Mm.
It comes to like the middle of your abdomen area, and then when I mean, I get full quickly.
Yes, yes.
Sorry, I'm stuttering, guys. I get full quickly, and then I can't breathe well.
Mm.
You'll get to a point you have to advise yourself. Because when that time I met you, that someone called to call you, I had just ordered this tea from China. It's by Nigerian, and she promised that it would work.
It will shrink it again.
Yes, it will shrink it. She gave me different times to take different things. It came with some tablets. It was in a box, well packaged, about 400 and something thousand. I bought
Wow.
it, Lori Ere. I was desperate at that time. I was getting to my 99.9%. I mean, my strength was already overstretched. I couldn't have relationships. I couldn't do anything. You can't even open up your body to any man.
Wow.
They'll ask you if you are pregnant.
Yes.
I couldn't do other things that would benefit myself.
And your business.
I couldn't go swimming with people. I couldn't go for,
Parties.
it was that bad. So there was one day, and then my friends were already saying, go and take this thing out. Olati yokinini, Olati yokinini. Nobody was even supporting me again that, Nisuru. I had to talk to myself, and then I started praying.
Started praying.
Yes.
Prayer. Good.
Yes. Now, going on to how I met Dr. Ben, there was this day I was in Surulere with my friend, and then I sat down. I had just finished eating, and then I was feeling this terrible stuff I was feeling. I couldn't belch, I couldn't do anything, and then I had to be holding the seat exactly like a pregnant person. So I just said, Holy Spirit, lead me. Lead me. I saw many pages on fibroid. There are many doctors online, who have fibroid surgeons, masters in the game, and all of that. But I was just like, God, just lead me to the one just lead me to the best. This is a matter of life and death. And we hear about so many people going through this thing and they lose their lives. So I just said, Lord, lead me. Lead me. You can never undermine the power of the Holy Spirit. I'm a Christian.
Excellent, yeah.
So whatever you worship,
And God is
you
the
pray
doer of the
about it.
miracles. Yes,
Yes.
God is one that does
So
the
I
working.
opened Instagram shortly after I did that prayer around maybe 12 noon. And then the page just came up. Benjamin Olowojebutu Foundation. I had never heard about your foundation or the work you do, or whatever, whoever Dr. Ben was. And I started going through it. I started seeing huge fibroids. I said, fibroid long you'll be at Sorry, that this is fibroid they are bringing out as if they are, dissecting
chickens.
Yeah. And then there were some particular posts you made. You were all about God and all of that. God is the love is the expression. I said, your love. But something just resonated with me. And then I summoned courage. I called the number of Twin Medical. And then, and again, you were doing, even, I had spent so much.
Yeah.
And then you were doing discounted. I said, really to discount. Anyway, I called. And then I paid on that day. I just locked up my slots on that day with a certain amount of deposit, like I was told to.
Yes.
That was the first step. I was just like, well, whatever happens. But I wasn't sure I was going to come for the surgery.
Okay.
It was just a way of boosting up my own psyche that, okay, at least I've taken a step.
Yes.
At least so that people will stop. Everybody was already saying, "Lo yokini now, lo yokin." I'm sure I was already irritating people. So, afterwards, I called the secretary again, and then it was the secretary that was talking to. And I said, "Can I speak with the doctor?" And then she gave me the particular number on the flyer or something to call the doctor on. And then I called, and then, you guys, you've heard him speak now. He was just like, "Yeah, hello, good afternoon," that kind of thing. I was like, Bobo Lenny, I was just like, I just spoke and I was like, hello, can I speak with Dr. Ben? I came on the phone with a very worried voice because I
Yes.
was worried. I was already scared for my
And you
life.
had pained. It was a painful voice.
Yes.
I remember that voice.
Yes. And then I spoke with Dr. Ben. And then the first thing was, I told him, Doctor, I'm really scared. Am I going to be okay? He said, have you done your latest scan? You know how doctors will ask? I said, I've done this, I've done that. He said, okay, that's fine. I'll still need to see you myself, blah, blah, blah. And I said, I've paid. He said, yes, it's not about the money you paid. I really need to see you. I need to see myself. I need to know what's going on. And then he now said something, you know what, Wendy? You know what? Fibroid is like the back of a coconut. Nothing you use can actually shrink it.
Correct.
I hope you've not been spending money. So I said, I've been spending money. He said, you have to stop that now. And another thing one day is just have this in your head. That's what you told me. He said, faith over fear.
That's it.
And then he went on to keep telling me something about, don't worry, God is going, you will be fine. You will. There was something reassuring about it, guys. And that was the day I made up my mind. That was the moment I made up my mind that, yes, I'm going to do this.
So you told yourself after that conversation that all the money I've wasted on this journey in the last 10 years must come to an end.
Yes.
But the first process was you prayed.
Prayed.
You prayed and you asked God to lead you to we is prepared for your solution. So sometimes, most time is important we have a conversation with God in our journey of life.
Most definitely.
So you had that conversation with God, and God said, call this guy that I have anointed to solve problems and take out monsters. He will be ready for you. And when you called, you got a reassuring voice of God in his voice, that there's God in this place.
I believe
there's
so.
faith over fear. Because many people are used to hearing and magnifying the wrong things and not focus on the good things. Because love is expression of the assignment. What it means is very simple. God gives us the will to do of his good pleasure. So God is a doer. We're just vessels of use by God himself. So God does the miracle through us. So it's not about Dr. Benjamin. It's about God himself ordained the miracle and showed you the process that there's a vessel of me ready to take out that monster. And you are reassured when you spoke to Dr. Benjamin. So go ahead with your story again.
Okay, thank you, doctor. And then should I fast forward to when I had my surgery? Okay, before I had my surgery, after I had prayed and then God led me to Dr. Ben, because I still believe it is God, just like he has said,
And you came for checkup, I saw you.
Yes, I came for checkup. And then in your office, I think I was trying to call you to tell you I was here. And then in your office, you didn't know me, I didn't know you. And, of course, I had seen your own picture. You hadn't seen mine. So you sent me a message, is that you? At the reception. And I said, oh, yes, doctor. He said, okay, you'll be with me shortly and all of that. And then I came in, you examined me and you were like, oh, yes, this is big. You need to take it. I started exhibiting the fear again, which, you spoke to me and then I laid my fears and all of that. And then before my surgery, I think you gave me an appointment because that your hospital, you are always overbooked. So you were like, oh, I should come probably in about a month's time, because I said I wanted the private ward.
Yes.
And then even your private ward is always already booked
Yes.
and all of that. So when you were ready for me, you kept on sending me messages, we're ready for you. And I'll be like, doctor, I actually have a program. There's a program I want to go for. The fear would not just leave you like that. We're talking about going on that. Doctor, you see all those your equipment inside that place now. I even had to make a request that they should please cover everything.
Yeah.
Remember?
Yes.
And then they were covered. I could
Yes.
still see some things.
Yes.
So I think I shifted my dates about 3 times.
4 times actually.
4 times.
Yes.
Okay. So, I'll say, doctor, I want to do this. You'll be like, okay, that's all right. The next time I said my church anniversary, I said juvenile anniversary. He said, you shall do this thing, sha.
Yes.
I said yes. And then December came. It was almost December. And then I think you had people from abroad and all of that. So you were telling me that the private ward was soon going to be filled again.
Yes.
So after my Christmas I said, okay, one last event, my church Christmas carol, which was December 17, 2023.
Yes.
And then on the 19th, you had given me the date. So 2 days after, I drove myself to the hospital. I mean, I had to just speak to myself with my Bible verses and everything. I had to summon the courage, doctor.
So you're speaking positively into your mind
I had no
on a
choice.
daily basis,
I had
correct?
no choice. My mom was encouraging me. She was like, don't worry, there's nothing. You know, my younger sister, Lola, you know, God bless her for me. You know, she was there and all of that. So I came in. I even thought it was going to be done in the morning. Doctor, you do surgery at any time. You know, some hospitals, they do it in the very early hours of the day. I don't know
So,
why,
so
but
I told you that that's the last time is because God always tells us when it's ready for the miracle. So it's
yes.
not about giving you time. It's about when God says it's ready. Because we do our surgeries fasted. You know, so that the thing I remembered, I told you about a story that I remembered in 2019, that I was already in a theater and I had already dressed up, and God told me in that theater that you can't do the surgery now. This woman is not ready.
Not ready.
She was already on the
Yeah.
table, and I said clearly, I said, "Madam, sorry, oh. God said you're not ready for the surgery." And I undressed and I went back to the office. But God told me not to go home that night. I stayed in the office, and at 2 a.m. I got like a tap, like somebody woke me and said, "Benjamin, now is the time for
It's
the
time.
surgery." So I took the lady at 2 a.m. to the theater, and about 4:30 she was out of the theater, done excellent surgery, to God be the glory. Then she left her phone in my office. And at 7 a.m. in the morning, somebody was calling her phone, banging, about 20 missed calls. So I had to pick. And the man just started ranting on the phone. Where's the doctor? Where's the doctor? Is it not 7 a.m. already? We did not do the surgery now. Is it not 7 a.m.? Should be say 7 a.m. And I said, sorry, sir.
This is the
We
doctor.
finished the surgery, sir. So why will you finish the surgery? Where is the family? So God told me that that's why you don't give timing to people, because sometimes people plan bad things around the time of the surgery. So you are only excluded. Just tell them the day of the surgery. When God is ready for you, you go into theater. That's why I don't tell anybody time for my surgery. It's just when God is ready. I can operate you at 8 in the night. I can operate you at 1 in the morning. I can operate you at 12 in the afternoon. Is when God tells me to go in there, because God is a doer. We're just instrument of use. So go ahead with your story.
Okay, and then I came for my surgery. I think I was like the third person for the day. And before then, I was making Snapchat videos so that I could do my before and after,
Yeah.
I was, in fact, when it was time, they had fixed everything on me and it was time to come down and all of that. And you told me something that, okay, I'm coming to that. So it was time I went down in my, what do you call it, in my surgical
Surgical
gown,
gown, yes.
right? I said yes. Now it's oh God. To God be the
To
glory.
God be
To
the
God be
glory.
the glory.
Jesus is
To
our
God be the
Father.
glory.
God be
I
the
went
glory.
downstairs, I came downstairs and then went into the theater, laid down. Your doctors, kudos to you, kudos to your staff. Those are really, really amazing people.
Thank
I
you.
remember the nurses, the doctors, the anesthetists.
Yes.
What do you call? I laid down. The anesthetist saw me. I said, God, oh, God, oh, hey. And when you doctors, the other doctor that was my friend that was always talking to me, I mean, I know it's a serious, serious job. The doctor's like, Madam, calm down, no problem. They had covered those things just the way I requested,
Yes.
because for fear and all this. It told me to lay down. I laid down. I was just like, oh my God. I couldn't, something was saying me I should run out of the.
Together. Are you
But those
serious?
people would they even allow, they will hold. I just laid down and then the anesthetic was telling me, calm down, calm down, calm down. You were the last person to come in.
With my music.
Yes, with your music. And then you told me there's this particular music you like using. I think is okay, la la, okay, well, or something like that.
Yes.
You told me earlier. So I thought that you were going to play that. And then you changed my own to one American song. I said, Then you not said, doctor, you changed your music. You said, yes, that's what my spirit wants to. That's what my spirit says. That I can remember everything.
Yeah, I remember.
Up until when I
went out.
when I zoned out,
Yeah.
And then I had the surgery. woke up some hours later
Yeah.
on the hospital bed
You
in
wanted a
the recovery
a
room.
bikini cut,
I wanted a bikini cut,
and your
yes.
fibroid was supposed to be a vertical cut because it was very big.
Yes.
And God helped us with bikini cut.
Yes,
How did you
and
feel
you look
about that?
certain. Very great. Very, very great. I'm coming to that.
Okay.
So I found myself in the recovery room. Yeah, my cousins were outside, my mom was outside. They didn't know I had woken up the other patient, the second person. Her sister went to call them. Oh, you're awake. You're awake, and all of the thing. You start coming back gradually and all of that, and then I was just like, oh my God, this is it.
And you saw the fibroid that day. Did you see that day or the next day?
No, I didn't see it that day. I think it was the next day, and then it was. You told me what that was the size of twins.
Yes, it was
5.5 kg.
5.5 kg, correct.
5.5. I mean, it was, and then my tummy was was so flat.
Yeah. Like a transformation.
I was like, is it? I can just. It was all covered plastered up, but you could see that. That's the first thing you first touch. That we will be told all those swollen places. I was just like, hey God, and then one thing I noticed is they didn't let me. I mean, the pain will come, which you had told me things to expect. That obviously you'll feel some pain and all of that. But one thing I noticed was the way they were giving me. I mean, once you tell them feeling pain, I think they understand the gravity or the how do you put it, this threshold or
Threshold of
something
pain, yes, correct.
of pain, and then they give you the appropriate medication to ease it up. And then when it comes again, it was. I mean, it wasn't easy, but yeah, it was all worth it.
So when you
It
saw
was
your
all
fibroid
worth it.
size, how did you feel?
I was amazed. I was astonished. And then again, you discovered that it wasn't just one.
Yes, it was.
Because my fibroid from the scan was always showing that it was just like a huge mass. And then there were some other ones. There was another one next in size to that one. And then I had multiples. It was, and then you told me that one or two had attached to my kidney and all of that. And then, I mean, I'm so grateful, doctor. I'm really at this point. I'm grateful.
To God be
I'm
the
very
glory.
grateful.
One of the things I thank God for you was it took us a while for you to get your faith up. I remember talking to you over and over again about faith over fear, speaking the right words to your mind, telling God about what the confessions are. It's 3 years now, and you're looking this fantastic. To God be the glory.
Thank you, doctor.
After your surgery, we gave you some instructions, meal plan that didn't look very, very sweet, like you're a very sweet tooth. How did you cope with that? Tell us about it. So they understand that there are follow-up instructions after the surgery. Go ahead, please.
I remember the meal plan, but Yorubas would say, "Ẹni tí Ṣàngó bá tọ́jú ẹ̀ wọlé, kò ní bá wọn bọ́ba kò sí or something." Yeah.
Okay.
If you know what you have gone through, you dare not disobey those rules. It's not like it's that bad. There was pepper soup in it. There was moi. I mean, light food, food that will build up. What is it? Is it my energy?
Yes,
or
your
what?
energy and also your blood. Yes,
and also my blood. And then you gave me some things, some
tablets,
and then this liquid thing that was in like
Totema. Yes.
It was that one was sweet. It was nice. I think you told me to take it for about a month or some days, and that was really good. Yeah, the meal plan was not bad at all compared to where I'm coming from.
So it was important that you followed through the instructions.
Very, very, very important. And I followed it for even more than the length of time you gave us to follow it.
And when you go to your partner and they're serving you meat, you tell them no, you don't want meat. You want only fish.
Yes, I've never actually been a meat person.
Okay.
I've always been a fish person. So that worked for me.
Excellent.
And then remember, even after like a year, I kept on asking, doctor, is it true that goat's meat is
it's part of it.
Even up to goat's meat.
Yes, that's
I don't even eat it.
Yes.
I just started doing that now.
One of the things that is important for our viewers to know is that fibroids sometimes listens to some kind of food. One of the food is, bread, red meat, carbonated drinks, suya, shawarma, eggs, egg roll, meat pies and stuff. A lot of people are used to those kind of meals. And if you're going to allow the fibroid to grow more, you will keep feeding on those kind of stuff. People eat it a lot of time because they enjoy it. You see a woman taking 2 or 3 Pepsi every day and thinks the tummy is getting bigger. She thinks it's the fufu or is the about that's making the tummy get bigger, whereas the fibroid is growing more and more. So when doctors give you instructions that will help you, please, it's important you follow them. It's for your own good. It helps your body get better. It helps you heal fast. It also helps the fiber not grow again. One of the things we try to do in the surgery is to take out every bit of the fibroid, even to the
Yes.
tiniest bit. One is 3 years post surgery now. She's looking very beautiful. She's done multiple scans over 3 years. No fibroid in her tummy. Now we're just expecting her to not come and give us a baby now, amen.
Amen.
When the boy comes around, so the baby to come. So fantastic interview today. Can you give us your final word and how you feel right now? How do you feel 3 years after your surgery? How has your productivity been? Your business, your work, your body? How do you feel in your body right now? Let everybody know how you feel and how gratified you are to what God has done in your life.
Thank you, doctor. How I feel cannot actually be put in words because I'm the one who knows where I'm coming from. And anybody going through fibroid now, or that has gone through this fibroid journey, and has gone under the knife, or done their surgery, can tell that there's a whole lot of different. There are two different lives. They are worlds apart. I went from pain. If there is another word for pain, I mean excruciating pain every month. And then when I was not having pain, I was bleeding. I bled for 1 year plus.
Wow.
I bled for 1 year plus.
Non-stop.
Non-stop, doctor. You know now, both blood and water. I told you everything.
Yes, I know.
There was one holiday I went for that. It was even abroad. I discovered. I was just going through YouTube one day, and somebody talked about the pads not being thick enough to hold blood for regular periods, let alone people with heavy flow and all of that. And it was from one of the comments I found out that you could use diapers.
Yes.
That was a turning point for me in the fibroid journey. Right? I quickly ran to Tesco. I bought size 4. They'll tell you you trim it by the sides, you use it. That was what gave me a bit of relief in my changing times. In my changing times, it was bad. But right now, I can't just be opening my tummy for you guys. I feel so good. You would think I had a liposuction. No, I didn't. It was all God and all thanks to Dr. Ben. And then my bikini cut is there. The sky is there, obviously. But I couldn't have it any other way. I couldn't have it any other way. I feel so great with myself. And then I'm able to do businesses. Doctor, I do over 10 businesses now.
Wow.
Apart from being a lawyer, now,
Yes,
Orange
yes,
Ideas.
yes.
Just that you've refused to give me contracts, but then we give God all the glory. And then I was made an ambassador
BOF,
of Benjamin Olowojebutu Foundation.
So tell us about your experience of following us to one of the medical missions in Osun State. How did you feel when you became an ambassador after your surgery? How did you feel about the mission work we do at BUF when you joined us on the mission as an ambassador? Go ahead and talk about it.
Thank you. It's a great pleasure to be a part of the team. I was even opportune to be in the theater. Doctor allowed us all sanitized, all kitted up to witness one of the surgeries. It was an outreach where you did over about, I think, 80 something fibroid surgeries, plus hernia surgeries, and what's the other one called?
Lipoma.
The appendicitis and lipoma at that village in Osun State. After Iwo, it was an amazing experience. I think we spent about 3 days. And you know me, I'm so extra. I had to be putting on. I made scrubs for myself.
Yes.
And then even the villagers thought I was a doctor. And then all we could do, Lola was there too. All your a few of your other alumni, and yes, Aret and Co, all of us. It was an amazing time. We're able to help. I was happy to help. And then even in Lagos, when you met the Shell people, when you met other people, I was there to play my part.
The
And there
support.
was a time you told me to speak with some of the patients, which
Yes.
I did, and I found great pleasure in doing that. I was able to allay the fears of, I mean, a lot of them, and then yes, the result was really positive. So it's been really good being on the BOF team, and yes, I'm ready to keep doing it for as long as I can.
Thank you very much. Thank you, Wande, for this very, very inspirational expository interview. And I'm sure our guests and our viewers will have enjoyed and been blessed by all your comments and your discussions today. I want to tell you one thing before we close today, family. Fibroid is not a dead sentence. Fibroid has solutions. Fibroid has help you can get on time. One of the leading causes of infertility and soft fertility in Africa is uterine fibroids. And as I always say, fibroids are very peculiar to Black people, Black Africans, Black Hispanics, Black Americans. Most times you need the knowledge of and the peculiarity of the fibroids in the Black race to be able to solve the
Yeah.
problem. You have to get the right help from the right people and the right encouragement. We are here for you to be a blessing to you by the grace of God. If you need to get help on time, you can send us a DM on our Instagram page at Benjamin Olowojebutu FDN. You can also send your scan or send to 0808 116 One of the things about us is love. Love is the expression of the assignment. We are sold out to love. We are sold out to encouraging you. And I believe by the grace of God, you are the next person for help. We have said this July, we're doing 100 surgeries in Abuja and in Lagos by the grace of God. And the monsters must all go. This is our podcast today. And I want to thank all of you for showing up, for following us today. Please don't forget, love is the expression of the assignment. God bless you and have a wonderful night today. Bye for now. Thank you.